Welcome to Clinician Real Talk, where we have honest conversations about what it really means to practice medicine in a value-based world. Today, I'm joined by Lea Witt, a family nurse practitioner whose passion is caring for patients with substance use disorders, people who are often overlooked, misunderstood, and underserved. Leah's here to talk about what it really takes to meet patients where they are and how value-based care makes that possible. Leah, welcome.
Thank you.
Yeah, so good to have you here. Tell us a little bit about your background, like where you started and how you ended up working with Optum.
Sure. Graduated as a nurse and worked in a local hospital in Ohio, and I did mother infant. So postpartum was kind of my niche and what I
Yeah.
loved, and decided that I loved being a nurse, but I wanted to have even more impact for patients, and also be kind of one of those clinical decision makers to really help patient outcomes. So went back to school, got my family nurse practitioner degree, and worked in urgent care for a few years. And the office that I practice now is actually the office I was a patient with. And my family doctor called me and said, "Hey, I'm getting ready to retire. I would love for you to come and join Optum, come join our practice and kind of help in that transition and help care for these patients." So it was a really neat experience to come on board and, work in a place that took such great care of me and to kind of continue developing those relationships with the coworkers I have, but then also caring for some of those patients as my family care provider transitioned out.
Yeah, that's excellent. So, what drew you to? So, you said you started with postpartum, and then you moved on to urgent care for a little bit. What got you started in this work? What drew you to caring for patients with addiction and substance use disorders and obesity?
In the role in the hospital and then obviously in urgent care, right, seeing so much of patients that have substance use disorders, obesity, and all of those, related complications. All of us have friends, family that we know that have been touched by addiction. We've all probably been touched by that in one way or another. And that is the case for me as well. I have addiction history in my family and have, seen firsthand those effects of what untreated addiction and some of those things can happen not just for an individual, but for their community and where they live. And so that really recognizing that those patients were neglected because providers maybe didn't know what to do or didn't feel as comfortable, really kind of gave me a passion for that. And then I graduated with my doctorate of nursing practice degree last fall. And
Congratulations.
thank you. And my whole doctoral project was actually about specifically alcohol use disorder and the under recognition of this in primary care. And how can we empower clinicians to feel more comfortable to bring up that discussion with their patient to provide some of those resources and help patients be healthier?
Yeah. What solutions were you thinking of when it like you I'm sure you saw the problem areas. It's like here's the gap. Like what solutions were you thinking of working on and are still probably working on to that you
Sure.
saw?
Yeah. So, one of the biggest things that I found in doing some research for that project was one of the biggest impacts is a provider's comfort level. When
Right.
providers feel educated and understand what resources are out there, what things they can do to help their patients, they're going to be more likely to bring up topics to help patients with those specific conditions.
Can you share any stories about the impacts of that, like working with this population and their potential for recovery, knowing what you know now?
One of the patients that I have taken care of for quite a while, came to me as a new patient with I'll say laundry list of medications
Okay.
that I felt were maybe a little bit too much. And there was a big hesitation on the patient from this perspective of, I need these. I don't think I can not have these meds. I don't think I can, not take these controlled substances, these types of things.
Mhm.
And really exploring and talking with her about that, what has happened now, we've gone from using a medication to treat an issue to now you're taking a medication to not feel bad,
Right.
and that
Yeah.
is a warning sign that something has transitioned here and is not really a proper use anymore. And it was a really amazing story. I will be honest that initially that conversation put her off a little bit. She
I'd
was a little
imagine
bit
so.
upset,
Yeah.
but She really did take that to heart, and it was a great experience to be able to see her back, 3 months later, and she had worked with me and had weaned off all these medications and was feeling better than she had really in, decades, and realized, like, "Wow, I really wasn't using these appropriately, and I didn't even recognize that in myself."
Mhm.
And, also hearing from her husband, who is also my patient, of just the impact that that has even had on their relationship and,
Yeah.
decreasing some of that tension and all of those things, and, both of them were just so very thankful that I was willing to have that difficult conversation and go ahead and maybe approach something that would be a little bit uncomfortable, and it was a great impact for not just her, but also for her family.
Yeah, going deeper into that a little bit, do you see that across the board where relationships can shift once somebody starts having these kinds of conversations and working with their provider in that way?
Oh, absolutely. And, the conversation shift doesn't just impact the patient's relationship with, like, their family, but even with the provider. And, that is something that, in order to start some of these conversations, really is about developing trust and rapport with your patient. That, I always try to make sure it's not me coming from a attacking,
Mhm.
um, antagonistic type of approach, but that I'm saying, "Hey, I care about you as an individual, and I care about your health, and I'm concerned about what I'm seeing, and I wanna help you."
So, speaking of that support, how would you say that value-based care gives you the time and space to build that trust and the build the trust that patients need?
Yeah. So, value-based care is really important in this work, especially in our older adult population. When we think about addiction, a lot of people think about young adults, teens, but there is a whole subset of older adults that struggle with this problem too. And oftentimes, without those visits, like their wellness visit or some of those longer visits to really get into some of those social determinants and those
Yeah.
things, you don't take the time to properly screen and have the time to really discuss those concerns with your patient.
Mhm.
And so having a setup or just an understanding of really being able to dive into someone's health, their concerns, their health outcomes is really foundational in being able to kind of pick up and recognize some of these things that could be a little more subtle.
Yeah. Speaking of picking up on things that could be subtle, addiction, it often goes undiagnosed for years, right? So, what are the signs that get missed by providers, and how do you catch them?
Sure.
In the system that you've developed. Yeah.
Yeah, so lots of different signs that can be out there, and I think it is also very individual person to person and sometimes across age demographics. So for, younger adults or teenagers, school performance issues, right? Mental health issues, withdrawal, increased depression, absenteeism, whether that's job performance, school related, those types of things. In older adults, it could show up as confusion,
Mm,
increased falls, frequent ER visits from
okay.
over medication or medication misuse. And in our older adult population, from a economic standpoint, that is something that we can see a lot of patients that could potentially be either abusing medications on their own or potentially selling medications to get extra income.
Sure. Yeah.
We know older adults have a lot of pain. They have trouble sleeping, right? Those are big reasons that people start some of these substances that could have an addictive potential.
Yeah.
And so recognizing individual nuances in that patient population, and then also just making sure to really evaluate, why do I have my patient on these meds? Am I consistently evaluating if this is still the right choice for them? Are they asking for a higher dose? Are they calling in or running out early? Are these medications being lost? Are they calling in saying my meds were stolen, right? Some of those things can all be red flags that
Yeah.
maybe we need to explore this a little more.
Hmm. So, will you share? I know you shared a story of one patient that you encountered. Will you share another story of a patient where the catching that those things that are normally not caught, and how finally naming the addiction finally changed things for the patient?
One patient in particular was on kind of multiple medications, which we know can increase the risk of adverse effects and bad outcomes, and really took about a year of
Okay.
slowly weaning these down, having those frequent visits and touch points. Saw that patient every single month, but, still making sure to say, if there's a concern that you have, if, yes, we're going to see each other in a month, but I'm here, I'm available at any time. And maintaining that patient access and to just say, you're not out here doing this by yourself. Like, I'm here. If you're concerned, please call me. And what's really amazing and empowering is that, most of the time, and this was the case with this specific patient,
Yeah.
we were able to not just decrease the dose, which was what I first suggested, but really wean off of these meds entirely.
Mm,
And in the end, they felt better.
yeah.
We did substitute and use some safer alternative options for them for their chronic issues that they were being prescribed for, but found that with newer, better options that were less risky, and the patient actually ended up feeling better. And instead of being concerned that I'm going to feel worse,
Right.
they actually improved.
Definitely. So, how does Optum's model support you in identifying and addressing those issues early?
Yeah. So lots of great resources that we have at Optum. One of the things that is newer in the past couple years that I have been a part of is what we call the APC fellowship program. And so we actually have a dedicated weekly teaching session just specifically around addiction and how do we recognize that? How do we screen for that? Very supportive from Optum in taking the time to do some of this education and to
Yeah.
get, to be able to attend those CMEs and to do some of those resources to feel better prepared as a clinician to talk with patients. And then just being able to have that value-based care mindset of being able to take those longer patient appointments if I need to and not having to just turn patients over quickly through the door every time, but to be able to take that time for a dedicated visit to make sure that every patient and their family is really understanding and on board with what we're concerned about and what we're trying to do to improve it.
Yeah. And also, like you just mentioned, like making sure you get that person in if they call, if they need to be seen. That's amazing. So you mentioned preventative care when we were talking a little bit earlier on. So let's talk a little bit more about that. How do you use preventative care to shift the trajectory for patients at risk of addiction or of obesity?
Yeah, so preventative care screening is vastly important. I make sure that all of my patients have a type of wellness visit where we can just specifically talk about what screenings do you need, what screenings are coming up to allow patients to kind of research and consider those options. And then also really explaining the why. Why do I want you to have a colon cancer screening? Why do I want you to have lipid screening? Why does that matter? And so, really taking that dedicated time to review all of those evidence based preventative guidelines, because even catching one patient, even making a difference in one person's health trajectory has dramatic impact. And that ripple effect, not just for that patient, but then for the community, as their family, all of those things, it makes such a big difference. So preventative care is a huge component of my practice, and oftentimes is that visit where I'll ask them about their alcohol use, I'll ask them about their drug use. So that can doing a preventative visit is a really great time to do some of those screenings for addiction and to kind of broach that subject when patients are open to talking about things that they don't really have their own checklist of what they want to talk about. They're coming in to just kind of hear, what things are you recommending for me? And so that can be a great time to bring up some of those things and really look at them more closely.
Yeah. Have you encountered any moments, and can you share any stories about where that early intervention really made a difference, either with substance use or with somebody at risk of obesity?
Had a really great conversation with a patient where, they had come in for their wellness visit and talking just about some various concerns that they had around, fatigue, joint pain, just very like non-specific things. And pulled in, into that discussion about their BMI and about their weight. Yes, patients can potentially be metabolically healthy, even
Right.
if they're obese, but that it still has an effect on their mobility and on their long-term outcomes. Had a patient that was 28 years old and very, very morbidly obese, and had a very, honest, transparent discussion with her about her asthma and high cholesterol and diabetes, and said, from a statistical standpoint, in the next 30 years, we are going to be in a very difficult place if we cannot improve your health. Really had a discussion with her around, because of her BMI at the time, around looking into bariatric surgery. And that for her was very frightening, right? I mean, as someone, a young adult, that's a major surgery, and she was very unsure about what she wanted to do. And I said, go to the information session, like just listen, see what it's about. And happy to say that I saw her last month. She had the surgery. She's lost 140 pounds. Her BMI is normal. She's
Yeah.
weightlifting 3 times a week. She walks
Amazing.
4 days a week, and I mean, when she came in this lesson, she's like, This has changed my life. Like,
Yeah.
I feel so much better than I ever have." She's come off of 80% of her medications, and, the impact on her life for the rest of that, but then also on her kids with making those better healthy choices with food and all of those things. It was, especially with being the, woman and the primary caregiver in her family, right? This has also changed the trajectory on her children too, and on some of their lifestyle patterns and behaviors.
Yeah, and then being able to see that example.
Yes.
Yeah. I imagine that was extremely gratifying.
Oh, it is. It is. It makes it totally worth it.
I love hearing the better outcomes, obviously. And how would you say that value-based care the model allows you to be more proactive instead of reactive, so we can get to those better outcomes?
So, because I think we have lots of resources out there to help patients with
Yeah.
value-based care, taking those time and making sure that we dedicate time to those preventative screenings is number one, right? Because that's where we're going to be able to identify and see, here are some early warning signs. And so that's the benefit of value-based care, is understanding and knowing what great network of resources we have, where I don't have to feel like I'm the only person
Yeah.
impacting this patient, that
Yeah.
we have a whole, it's a spoken wheel model, right? Where we have multiple different people in their expertise and in their lines of work that can come alongside and impact this patient. And the more touch points that we have and the more different ways that we look to address an issue, the better that outcome will be.
I imagine there's a lot that you have to deal with emotionally. So, what kind of support have you found at Optum that really helps you keep showing up for your patients?
Clinician well-being is so vitally important, because if we are not taking care of ourselves, we can't show up and be the best provider for our patients. And so, having some of those extra resources that are out there, some of the clinician well-being visits and summits and opportunities that are out there. The Optum Provider Development Institute has a lot of things on clinician burnout. I also think it's important to stay connected to other providers and to be able to network with each other.
What does that look like?
Yeah, so that's been really great for me personally, and then just being a part of Optum nationally. So, like the Optum Partnership Forum, where we can network with providers across the country, even doing things at a more regional level, connecting with other providers, even from different offices or different states, to really be able to share best practice, to feel supported, to realize that you're not the only person potentially dealing with this issue, or getting innovative ideas of have you tried this, or have you thought of this? This has really helped me in the past. Building that community for yourself as a clinician is so important too, because the work can get heavy, and it often does. And it's more manageable when we can share the load, and when we can realize, like, this isn't just a me problem or a my patient or my office problem, but this is part of healthcare and other people are experiencing this too. And here are the things that they've done.
So, you talked a little bit about the partnership. Are there other ways that you experience, meaningful belonging?
So that has been really part of my leadership journey here at Optum. So about 4 years ago, I was approached by my leadership to say, we would like for you to serve as kind of this lead nurse practitioner in in our local area to really come alongside and encourage and support the local nurse practitioners, physician assistants, and just, be that resource and be that voice for them. I just actually this week was made aware of a situation with a specific nurse practitioner and had on just a couple days ago, right, a 2-hour phone call with her of, what are some of the concerns that you're having? What has been, what are some of the barriers, the issues that are preventing you from, feeling like you get things done, getting those charts done, seeing the patients you need to see, feeling like your workload's manageable. And so then being able to use some of the resources we have nationally and some of the networking that I've gained with that to help this one individual provider. And then that ripple effect is so huge, right? When we create a environment where every person, whether they're a clinician or even non-clinicians, feel like they have a opportunity to speak and have their voice heard, it doesn't just improve business metrics or, provider satisfaction or, decrease burnout, but it also helps our patients.
Right. Yeah. So, what would you say to a clinician who wants to do this work with patients who might be struggling with patients who might be struggling with addictions or obesity, but they don't feel like they're equipped or supported?
Yeah.
Yeah. How does Optum help set the stage for success?
My recommendation would be like, take those classes, learn more. There's great addiction societies out there and obesity societies where you can, do those CME. That's the beautiful thing about Optum is that we are allowed time and opportunities to
Yeah.
take that education and to, continue to grow and develop as a clinician. And once that education is there, then you really can, I guess, say, have your eyes opened to really see the need in your own community and be able to impact where you work and where you live.
Leah, tell me why you think Optum is uniquely positioned to transform healthcare.
Sure. So the great part about Optum is that we are not operating in just a silo. It's not just one region, one state, one type of health system. That Optum is really reaching our patients at all different levels of their health journey, whether that is from a hospitalist, from a primary care office, from a wellness center. We are able to impact patients at all different levels of that healthcare journey and across the region, national, like across it's national, right?
Yeah.
And that is so beneficial because I believe that it really helps to see what is happening with patients in the United States. This isn't just a state issue or a specific local issue, but really able to say what's happening in our healthcare nationally and what are some of the overarching themes and concerns that we're seeing and what are the meaningful areas that we need to change to improve health, not just in one specific place,
Hmm.
but everywhere.
Yeah. And why do you think more clinicians and medical groups should consider joining Optum?
Yeah. So, as a nurse practitioner that is a part of Optum, and I have many friends, locally that work for different organizations or healthcare systems. And in my discussions with them, they are frequently shocked and surprised by
Right.
the amount of resources, opportunities, and even just knowledge base
Yeah.
that we have access to as Optum clinicians.
Leah, thank you so much. This has been an amazing conversation. I feel like I could sit and listen to you talk for hours. Thank you for your honesty, your heart, and your commitment to the work. Wonderful. If you are a clinician who knows you need to transition to value based care, now is the time to assess how ready you are to make the shift. We've created a quiz for you to take to do just that. Click on the link in the show notes to take your quiz today. For clinicians listening, if you're looking for a model that gives you the time, tools, and support to care for the whole person, especially those who need it most, this is what it can look like. Subscribe to Clinician Real Talk for more real conversations with clinicians making real impact. See you next time.